Namaste viewers, welcome to our discussion. January is a cervical cancer awareness month for which we at Apollo Hospitals have come with a live discussion on all you need to know about cervical cancer. And for our discussion, we have with us Dr. Sai Lakshmi Daayana, consultant Gynae Oncologist and Robotic Surgeon at Apollo Hospitals, Jubilee Hills, Hyderabad. Welcome doctor to our Facebook discussion. First question, what is cervical cancer?
A cancer which affects the lower part of the woman's uterus is cervical cancer. Unfortunately, this happens to be the commonest cancer which is killing women in India and similar developing countries. This cancer is so common because this cancer happens when a woman starts to engage in sexual activity or a family life. I'm sorry, I did not mean the cancer happens, but the virus which causes the cancer enters the woman's body during sexual intercourse, and this virus never dies. So this virus has no end to it. This virus will live in this woman's cervix forever and then keep causing infections, and these infections will progress to cancer. So cervical cancer is caused due to a sexually transmitted infection with a virus called HPV, and this is the most common cancer which is killing women in India and in developing countries.
Thank you, doctor. Next question, what are the signs and symptoms of cervical cancer?
Again, unfortunately, any cancer has 4 stages, and stage 1 cervical cancer, which is a curable cancer, has no symptoms whatsoever. So for example, if a woman who has HPV virus in her cervix is slowly progressing to a stage 1 cancer, she will feel perfectly normal in herself, she will have perfectly normal periods, no issues at all, no symptoms at all. And even if a gynecologist did examine her for whatever reason, the gynecologist cannot pick up this first stage cancer because it's invisible to the naked eye. So the only way to pick up first stage curable cervical cancer is by undergoing Pap test. But if say the woman did not have a Pap test and the first stage cancer progressed to second, third or fourth stages, then she will start to have symptoms which are usually bleeding problems or vaginal discharge, which can be white, pink, red, brown, whatever. It can be smelly, it can be non-offensive. She can have bleeding during sex or after sex. So any woman with any type of bleeding issues could be having a cervical cancer at an advanced stage, and therefore we urge every woman who has any type of disturbance in between periods in the form of bleeding or vaginal discharge should be checked out. But if a woman does not want to have cervical cancer or want it to be caught at a curable stage, then she will have to undergo a Pap test every 3 years from the age of 25 to 65.
What are the causes of cervical cancer?
Cervical cancer happens due to a viral infection called HPV. HPV is a very common virus. It can go between wife and husband who have just been with each other all their life. So even in monogamous relationships, we see cervical cancers due to HPV infection. And HPV infection can enter a woman or a man's mouth, vagina, penis or anus, depending on which route they have sexual intercourse. So HPV virus is the cause of cervical cancer, and HPV virus has no death. Once it enters a human body, it stays in the body forever, and that is why these HPV associated cancers are extremely common.
In which age group cervical cancer is mostly seen?
Cervical cancer takes time to happen. That is why we say the Pap test done every 3 years can stop cervical cancer. So say for example, a woman became sexually active at the age of 25 when she got HPV infection. It would take at least 10 to 15 years for that HPV infection to turn into a cancer. So this woman would probably get a cervical cancer at the age of 40. So we said typically the cancer is seen 10 to 15 years after the onset of sexual debut. But that doesn't mean every woman who has sex and who has HPV will get cervical cancer. It only happens to few women who get HPV infection.
How are cervical cancer diagnosed?
The first stage curable ones are diagnosed on pap smear, and the woman, now the doctor, will have no idea that this has happened to them. The advanced stage cervical cancers are diagnosed when the woman comes with bleeding problem or vaginal discharge problem, and they are diagnosed by taking a biopsy from the tumor, which will be visible when the doctor will examine you.
Doctor, could you please elaborate about robotic surgeries for treating cervical cancer?
Look, cervical cancer is treatable with surgery only if it is in the first stage. And the first stage cervical cancer could be treated by making a cut on the abdomen called open surgery. It could be done making smaller cuts on the abdomen called minimal invasive surgery, which is laparoscopic. In those high centers, where they buy very expensive machinery and use good technology. For example, in Apollo, we have a robotic assisted laparoscopic surgical option. But one thing we all need to remember is about 4 years ago, a very large study conducted in Europe said that for cervical cancer, women survive longer with less chance of the cancer coming back if you offer them open surgery compared to laparoscopic or advanced laparoscopic surgery. And since we have we surgeons are preferring to do open surgery for cervical cancer. But if it was endometrial cancer, uterine cancer, any day I would advise the woman to undergo robotic assisted laparoscopic surgery, because within a week this woman will be back to her normal self and will recover from her cancer much quicker.
We heard something about 3D printing. How does it help in cervical cancer surgeries?
Look, many cervical cancer patients are at a very young age. If you look at India in the present state in 2023, a lot of young girls, even before marriage, are becoming sexually active. And these young ladies actually do not prefer to get married until they are into their 30s and do not have time to have a child until they are into their mid 30s. I'm seeing a lot of ladies, who are planning a family once they hit 33, 34, 35. There's nothing wrong with that. This is how the current generation is. But this also means I'm seeing a lot of young ladies who are just married or not yet married or who haven't yet had their first child, and they already have cervical cancer because they have been living in a Western style where they're becoming sexually active at a young age with more than one partner. So this young woman would want a child and also has a cervical cancer, and this is a kind of person for whom I would prefer to just remove the cervix and keep her uterus so she can still get treated for her cervical cancer and also still be able to have a child in future. This is called a radical trachelectomy, where we only remove a part of the uterus where the cancer is. If I'm only going to remove a part of the uterus and not the uterus in total, I need to know the dimensions of this tumor. I need to know exactly the shape and size of this tumor, which is where our additional technological services like 3D technology, 3D imaging will come into picture.
How long does it take to recover from cervical cancer?
It depends on which way your cancer is treated. You come to us in stage 1, early stage, and we perform a radical hysterectomy or radical trachelectomy, then it will take you about 2 months to fully recover from surgery and get back to work or studies or whatever it is that you do. But you come to us in stage 2, 3 or 4 cervical cancer, which is an advanced stage, and we give you chemotherapy and radiation therapy, then 1, it will take you a few months to recover from this, and 2, we cannot guarantee that you've been cured. So there is a possibility the cancer might come back, and you have to be under very regular follow-up for 5 to 10 years or for the rest of your life.
Are there any chances of reoccurrence of cervical cancer? How can we prevent it?
Any cancer can reoccur. The fact that a cancer happened to a person means that cancer can happen to the person again and again, even after the organ from where the cancer has been removed. Stage 1 cervical cancer is usually curable, which means it might never come back. That is because the cancer was caught when it was very early, at a very small size, and it hadn't had time to spread to other parts of the body. But we cannot guarantee cure with stage 2, 3 or 4 cancers, and any cancer patient, if they do not want the cancer to hit them again, they need to stay under very regular follow-up for minimum 5 years.
Does cervical cancer spread?
Cervical cancer does not spread. It is not an infectious cancer. So if you sit, sleep, eat, share whatever you share with that person, still you will not get their cervical cancer from them. But the virus which caused the cancer, the HPV virus, it spreads from person to person through sexual activity.
Thank you, Doctor. Coming towards our last question, Doctor, could you please tell our audience about the facilities and services available at Apollo Hospitals, Jubilee Hills, Hyderabad?
Apollo Hospitals, Jubilee Hills, Hyderabad offers so many cancer screening and prevention services that, the list goes on forever. We have innumerable packages to suit each individual. But on this one occasion, if there is one package which I am a great fan of, which I advise any woman who is more than 40 to undergo, it's our female cancer screening package. For logistical reasons, maybe I'm not allowed to tell the price of this package as such, but this package is much less than 5,000 rupees. And this is called a female cancer screening package, which basically means any woman who might have a cancer in her body anywhere from head to toe, this package will pick it up. Because in this package, we cover mammogram, we do a pap test, we do an entire scan of the abdomen and pelvis, we do a blood test, we do lung screening, we do liver screening, and we do a urine which covers kidneys, urinary bladder and ureters, and we do a motion sample for cancer screening which covers the whole intestines. So if for a very small price, this package is permanently discounted in our hospital to encourage women, and if a woman undergoes this package, which takes about 3 to 4 hours, and a breakfast is included in this package because we ask you to come on an empty stomach with a motion sample, then we can almost guarantee you that we probably have not missed any possibility of a cancer in you. So I encourage any woman who is anywhere in Telangana, Andhra Pradesh, if you have an opportunity, please undergo the female cancer screening package at Apollo Hospitals, Jubilee Hills, Hyderabad. There is no similar package to match, and our mammogram machine is one of the best in the city, which has a very high resolution. We will be able to pick up a breast cancer which is just as big as the size of a ice cream.
Dear viewers, we have come to the end of our session and hope we have covered all aspects. If you still have more doubts, you can book an appointment with Dr. Sai Lakshmi Daayana and clarify your doubts. Link is in the description. Thank you, Doctor, for educating our audience in today's session. Thank you for joining us. Stay tuned for more such educative live sessions. Namaste.